Hello everyone, today we'll talk on the medical textile. Let us start with the introduction. The textile has always been a part of healthcare. The combination of textile technology and the medical sciences has resulted into the medical textiles. The medical textiles are one of the faster growing sector of the global technical textile industry. Latest innovation, that is wide variety of woven, non-woven, knitted forms of textile increasingly finding their way into variety of surgical procedures. Let us see the material used in medical textile. Monofilament and multifilament yarn, woven structure, knitted structure, non-woven fabrics and composite structure. Let us see the classification of medical textile. The textile used in medical and surgical purposes can be classified as non-implantable material, that is wound dressing, bandages, plasters, etc. Extracorporeal devices, for example artificial kidney, liver and lungs. Implantable materials like sutures, vascular graft, artificial ligament, artificial joint, etc. And finally, the healthcare hygiene product, that is bedding, clothing, surgical gowns, cloths, wipes, etc. So these are a few examples of medical textile. So what are the requirements of medical textile for medical application? It should be biocompatible. It should have good resistance to alkalis, acid and microorganisms. It should have good dimensional stability, elasticity free from contamination or impurities, and absorption, repellency, and finally air permeability. So what are the textile fibers that are used in medical textiles, their applications and functions? The first one, that is hollow polyester fiber or hollow viscose. The application of artificial kidney and its function is to remove waste product from the patient's blood. The next fiber, that is hollow viscose, its application in medical textile as an artificial liver. Its function is to separate and dispose of patient's plasma and supply fresh plasma. Hollow polypropylene fiber or hollow silicone membrane. Its application is in mechanical lung and it removes carbon dioxide from patient's blood and supply fresh oxygen. So these are the few examples of textile in medical textile. So the medical textile products are bandages, wound care, sutures, vascular prostheses, plasters, antimicrobial fabrics, cartilage and bone generation, stents, cell growth technology, orthojoints, nerve reconnection and regeneration, breathing mask, bedding and covers, and artificial kidney. So here is an example of stent implantation. A stent is a tiny tube placed into an artery, blood vessel or other hollow structure in our body, such as the tube that carries urine to hold it open. So these are the examples. What are the fibers to be used in medical textile? The first one is the commodity fiber and the second one is the specialty fiber. The commodity fibers are again classified into the natural and regenerated fibers and synthetic fibers. So natural and regenerated fibers are cotton, silk, viscose, whereas synthetic fibers are polyester, polypropylene, polytetrafluoroethylene, polyamide, carbon and glass fiber. And specialty fibers are collagen. It is obtained from cow skin. It is a protein available either in hydrogel or fiber form, and collagen fiber when used as a suture are equally strong as a silk and biodegradable. Here you can see the collagen fiber structure. The second specialty fiber, that is calcium alginate. This is made from brown seaweed. This fiber possesses healing properties. So calcium alginate fibers have been proven to be wound healing. Wound dressing made from such fibers are non-toxic, biodegradable and hemostatic. Specialty fiber is chitin. This is a polysaccharide that is obtained from crab and shrimp shell. It has excellent anti-thrombogenic characteristics. It can be absorbed by the body and promote healing. Artificial skin made from chitin non-woven fabric or stimulate mucin formation. The next important specialty fibers are chitin, polycaprolactone and polypropylactone. Again, these medical textiles fibers are classified into the biodegradable and non-biodegradable. Biodegradable fibers are those fibers which are absorbed by the body within 2-3 months, whereas non-biodegradable fibers are those fibers which are not absorbed by the body in a period of 6 months. So the classification of medical textile is into a non-implantable material. Non-implantable materials refer to those used outside the human body to assist the recovery of wounds. These include wound dressing, plaster and bandages. You can see here a few of the examples. Non-implantable materials are wound dressings or materials used for wound healing to provide protection against infection, to absorb blood and exudate to promote healing, to apply medical application to the wound in some instances. Some others are contact layers, absorbent pads and the base materials. You can see here in the pictures the simple elastic bandage, light support bandage, compression bandage and orthopedic bandage. Non-implantable materials, gauze, lint, wadding, plasters and extracorporeal devices, and these are the artificial organs that are used to replace the diseased one. There have been artificial kidney, liver and lung. The making of these devices require precise design and manufacture. These properties of such devices are vital. You can see here the blood vessels made up of hollow fibers. You can see here the blood vessels, artificial lung. Extracorporeal devices, artificial kidney, it is made up by the hollow polyester, hollow viscose. Its function is to remove waste product from the patient's blood. Artificial liver, hollow viscose, to separate and dispose patient's plasma and supply fresh plasma. Mechanical lung, that is, it is made up of hollow propylene, hollow silicon and silicon membrane. The function is to remove carbon dioxide from patient's blood and supply fresh blood. And implantable materials, these are the textile structure that can be used inside the human body for various purposes such as sutures, replacement surgery, vascular graft, artificial ligament. And available products are sutures, vascular graft, artificial ligament, artificial joints, scaffolds for tissue growth and so on, each providing suitable properties for the end use. Thank you very much.